as we head into the end of the year, we really expect a lot of the final pieces we're waiting on to be up and running. We have see some coming to fruition soon, and certainly 2011, we're going to see a lot of transition. This is a time of transition. We can talk a lot about the human transition, renaissance we're seeing. And at the crux of it are just these things that Bob's talking about, the economic problems, of course. And I know quite a bit about these problems. I don't think there's an easy solution right around the corner, though we would like to believe so, and optimistic thinking doesn't do us any harm, but we need to be prepared. And at the root of this economy is our health care. I mean, I really think that's one of the main reasons that's causing us to be in such a funk, if you will, with money problems and corruption and greed. None of us can think straight. Our bodies are a mess. The biochemistry is behind it all, and that's what we do in the medicine. So as I was saying before Bob was able to hook back in there, we're using these initial meetings for training as kind of a venue to record what we call the New Medicine Foundation 101 material, several hundred slides that we've created over the years that explain what new medicine is, the science behind it, how we do what we do. We're going to continue doing that for the next 4 to 6 sessions, I think, maybe a few more. Tonight we're doing, last week coming off of what we call functional nutrition, which, a quick recap, the key components of new medicine are our organic detoxification system, the cell center program, appropriate, conservative, healthy aging-based hormonal balancing. A key component of getting people healthy and preventing illness and feeling better quickly is hormone balancing, and new medicine does it the right way. And then functional nutrition, which kind of envelops all of the science that's involved in new medicine. A lot of what is known as functional medicine out there that was a large part of our training in creating the science of new medicine. But we've really whittled it down to the key efficient testings that need to be done, applying the explanations to the illnesses out there, applying it to our food and why we have to learn how to eat real food and what organic foods are and why food is such an important part of our body's functioning. So that's what we're doing tonight. We're going to come off of the quick discussion we had last week of the importance of the #1 deficient nutrient or hormone, actually a hormone out there, D3, vitamin D3 that was talked about last week. We talked a bit about vitamin Bs and how broad spectrum they really are important across the board, and we really shouldn't waste too much time singling out all the different Bs. And we'll go into the rest of those tonight. We may have time to get into some of the specific diagnoses that we're going to get into after the next bit of biochemical discussion. We'll get into heart disease and Alzheimer's and cancer and all of these things that really are variations on a theme in the body, variations of our bodies saying they're toxic, they're malnourished, they're biochemically a mess, and we've got to fix it. And so we're going to get into maybe the third or just another big nutritional deficiency out there, which is omega-3 fats. Before I do that real quickly, I'll touch on one other important aspect of the key economic issues these days. You know, there's some great information coming out. There's a website that I might promote here. It's something I look to. I look to a lot of good websites or organizations for truth. It's called inflation.us. It's a little bit pessimistic about the state of things, but they came out with a really great video the other day called The End of Liberty. And I was really thrilled to see about the first half of the video of an 1:15 long documentary, which is a great film. About half of it was devoted to the fact that we're all sick, we're all ailing, we all want real food, we're sick of all the drugs, and we know this to be true. And it's being really pushed down by the political entities. And there's new laws and bills that are threatening the ability to even grow and sell locally grown food. So this is all going to implode. It's great to see that a big economic organization like that is recognizing food and health as one of the big problems. I agree completely. And we just got to start eating real food again, and it's really our poor health is at one of the foundational problems of our current state of the world. So we're going to get in and finish up the functional nutrition aspects tonight. Omega-3 fats, moving on from vitamin D3 and B. We have been misinformed on fat for quite a few decades. We could go back to maybe the 80s when we went on the low-fat craze and we all started eating low fat, replacing that fat really with sugar and additives, and we all got fatter, and diabetes and heart disease and all of the illnesses just continued increasing at epidemic rates. The truth to nutrition and perhaps I would go back to the functional medicine nutrition pyramid, but without going there, there's good fats and there's bad fats. There's good proteins and bad proteins, good carbs and bad carbs. Really, any kind of healthy natural or organic nutrient is going to be okay for us. It's the synthetic, toxic, man-created, God move over, lab-created nutrition stuff that's really the worst for us. But a broad overview is that there's good fats. Natural fat is good. And we've really gotten away from these with these low-fat crazes and all of these dietary crazes that we get on. You can't, there's no diet that reduces a particular natural food group that is healthy for you. What we went to over the last couple of decades was trans fats, and those are synthetic, fake, toxic fats. They're horrible. Whereas natural fats like omega-3s we'll talk about, we fairly well know all of these, but we're really deficient in them. They come from fish and nuts, natural sources, flaxseed, vegetarian sources. They are liquid at room temperature. They stay liquid in our body. They lubricate our body. They reduce inflammation. They do everything that kind of like healthy motor oil does for a car. It just makes things run more smoothly, get less corroded, less inflamed, less degenerated. They're fats that are liquid at room temperature, and we've really abandoned them in the past several decades, again, for more of the bad trans fats that are in almost everything that we shouldn't eat, everything that's in a box in the center of the kitchens, everything that's fried out of the fast food fryers, which those fats let that food cool for a while at room temperature. It becomes solid, and that's exactly what it does in the body. It clogs everything, creates inflammation, creates rust and wear and tear and oxidation. So we simply have to get back to the more natural fats. Omega-3s, here's a brief overview. Again, it's great to learn some fancy words to throw out and about there. That's really all it is memorization. Eicosapentaenoic acid, I can't even say it now, docosahexaenoic acid. These are the two big ones. Very anti-inflammatory, lubricative, very important for brain development in children. In adults, we have more inflammatory problems, so we should really focus more on the DHA. In kids, it should be more of the DHA, the EPA, or the EPA in adults, the DHA in children. We tend to do this when we recommend supplements. We don't. You can look at fish oil or omega-3 supplements and see 100 different kinds, but we keep it very simple for people. There's 2 or 3 kinds we promote based on their states in life, but very important. And now to touch on that a little bit more, saturated fats, are those bad for us? Well, no, they're not. Of course, everything in moderation. So saturated fats are very high in animal proteins. We need animal protein too. We believe in a broad spectrum diet. Of course, we shouldn't live solely on bacon, even if it's organic bacon. But we know that the Eskimos up in Alaska live on seal and whale fat and blubber, and they never have the same kind of health problems. Now, they have other issues. They actually have bleeding problems because they're so loaded with these healthy fats, but saturated fats have been studied very, very well. It's not saturated versus unsaturated that's really the problem. Yes, we need more unsaturated fats, but we just need organic fats, real nutritional fats, because fats and animal products, because most toxins are fat soluble. The problem isn't the fat. The problem is the toxicity coming with the fat. So there's some great healthy saturated fats out there, coconut oils and avocados and palm oil, and fats that they will solidify a little bit sooner, but they're still mostly liquid at normal temperatures, and our bodies love them. And they've been heavily studied, and they simply don't make you fat and they don't make you sick. So we've got back to healthy fat, good fat versus bad fat. It's very simple. We shouldn't avoid fat. In fact, we're very, very deficient in fats. We need to supplement with them. We need to look for them in our diet. Of course, first and foremost, we just try to eat more fish, eat more nuts, even supplement in your diet some healthier cooking oils like coconut oil, palm oils, things like that that really have kind of lost fashion for the last couple of decades with all of the polyunsaturated vegetable oils that really aren't that good for us. You can test for these fats. You'll find them deficient in almost everybody out there. About 99% of all people are deficient in these fats, and we're really overloading on omega-3s. I should say omega-9s and 6s and other, not trans fats, but the synthetic trans fats. We need more omega-3s. We need to stay away from the trans fats and anything that's not organic, of course. So that's a big one. Vitamin D3 is number one. Bs are in there. Omega-3s are in there. Probiotics is one of our other favorite deficiencies. These are the good bugs. Couple interesting points on this. They're getting pretty popular in the media. I'll say that anything you see in the media probably is not a good supplement. I could say Activia and most other products. I just know that these healthy bugs, the healthy bacteria that we need to help us digest and balance our GI system, our intestinal system, and thus our immune system, which 70 to 80% of our immune system lives in our guts. Why our food and our gut and regularity is so important. But you've got to keep these bugs alive. You've got to keep them happy, so they have to come from a reputable source. Most of us are dysbiotic. We've got lots of bad bacteria and parasites and fungus, candida yeast, not a lot of the good stuff because we've been exposed to so many toxins and poorly nutritious food and antibiotics that all of these good bugs are gone. So they should be replaced. It's something we typically add into most of our patients, a good probiotic early on, and then teach people how to take it as needed depending on their bowel habits. It should be high quality, lots of different strains of bugs. We should learn how to eat prebiotics. Prebiotics are the food that the probiotics eat, mainly it's fiber. That FOS there is fructooligosaccharides. That's the things in fiber that keeps these bugs happy. And it's kind of shocking, but we have more of these bugs in our body and around our body than we do our own cells. So we are more not us than we are us. We need trillions of these bacteria to help us live normal, healthy lives. So we typically see this dysbiosis in stool testing or gastrointestinal testing. We don't do it primarily because almost everybody out there will have similar looking tests. We'll have dysbiosis, we'll have some candida and yeast and have poor digestion. We know this to be true, so we basically just focused on the detoxification, replacing some probiotics, getting everything, the basic biochemistry balanced, and we find that most people's GI systems balance themselves out very nicely, and we save not only the expense and the hassle of the GI test, but nobody likes collecting stool, so we just skip that unpleasant experience altogether. Here's the foundation of our health nutritional pyramid. Water, water, water. 70% of the earth is water. 70% of our bodies are water. We do not drink water. It really is the forgotten beverage. And now there's the question of just getting healthy water. Healthy water should be rain that comes down through the earth and the bedrock, gets filtered through and up into springs, and it's just perfectly soft and mineralized with low surface tension. That doesn't happen anymore. Now we're on the bottled water kick, and we're drinking really not much water. We're drinking mostly artificially flavored and chemicalized sodas and pops and juices and Lord knows what. Well, it should be water. We should drink this much water there that we see kilograms. For an ounce for your weight in kilograms or more in pounds, somewhere between there is going to get most people to a half gallon to a gallon a day. You're very dehydrated in the morning, which is a good thing because you should weigh yourself. You'll be nice and light, but then you should start hydrating. I typically have my first quart or two before I even leave the house and sometimes get through 4 or 6 quarts in a day. Just learn to drink water. If you don't want water, flavor it with tea. You can count your organic coffee. You can certainly count organic fruit juices. You just don't want to overdo that. And you want to get healthy water as healthy as you can. There's mineralized versus RO. That's a whole different topic. I like atmospheric generators that just pull it out of the air and filter it and then get my minerals from food. But getting healthy water is also good too. Don't do too much bottled water or deionized water, and avoid the bottles. Don't drink a lot at night. That makes a lot of sense. Don't drink a lot when you eat. You want your stomach to be full of food and enzymes, not full of water when you eat. And at night, of course, you don't want to get up all night to go to the bathroom. Once is normal. So just turn the water down during the day. Usually you'll find that's kind of natural when you've hydrated very well all day long, and that's what needs to be done. Now, getting into the science of how we test for some of these deficiencies, again, the probiotics and the omega-3s, we kind of avoid that testing. We found it to be unnecessary. With water, it's very obvious on standard blood tests. You'll see high BUN to creatinine ratios. That's a kidney flow ratio there. You'll just see people dehydrated. We always stress that when people are fasting for the labs, don't stop drinking water. You want to stay nice and hydrated. Makes the blood draw much, much easier. The visit to the vampire station. And with the water, issues of getting clean water we were just discussing, you shouldn't spend too much. You can spend $5,000, $10,000 on units. You can spend, I think, $1,000 or $2,000 might be reasonable to get a good water producing unit in the house. That's an atmospheric generator that will give you endless water, maybe a couple $100 maintenance a year. Or you can spend a couple hundred and get an under sink system. But you don't have to spend $5,000 or $10,000, and you shouldn't. There's you see some systems out there talking about the very high pH water. Yes, water should be alkaline. It's very acidic these days, but a lot of the multi-$1,000 systems are not worth it. There's talk of a global crisis coming up. Hopefully not. We'll see. We need to get back to just basic water supply, but it is the basis of life, both for the earth and ourselves, and we are deficient. A lot of talk about minerals. We're tremendously deficient in magnesium, potassium, other minerals. Magnesium's a really big one. And talk of should we spend the large amounts of money on mineralizing the water? Well, it is pretty expensive, filtering it through rocks or doing whatever we need to do to make it work like the earth works. We say it's a lot simpler and more efficient to just get your minerals from your food. Eat healthy foods, eat raw foods as much as you can. Use broad spectrum sea salt. Sea salt has almost every mineral we need in it except for iodine, which we should get from green leafy vegetables. Sea salt's delicious. There's nothing wrong with using judicious salts on our food as long as it's healthy salt, which again is broad spectrum. It's colored, it's full of different kinds of minerals, and it's very rare actually that someone's high blood pressure is only caused from salt. It's very rare that it's even caused from it. Typically blood pressure is just a stress effect. So we get our patients back to really eating delicious foods again with not only salts but lots of spices and other things too. Of course, the healthy fats make food delicious again. So that's part of the educational experience that comes out of getting healthy, is that people learn to eat real food again. They get away from the toxic chemical food that's killing them, and they get back to real, rich, flavored, spiced food that is so delicious, and their taste buds are back to normal and they're biochemically balanced, and that's the joy of this experience. And it's just incredible to me that from the comfort of your own home in 3 weeks you can start to experience these things. I want to get a little bit into, we've got some more time here, and what we're going to get into now is more of the specific illnesses, the true science behind what these illnesses are that everybody's getting and why they're really variations on a theme. We did a webinar last week that covered some of this, so I'm going to gloss through these slides pretty quickly. There's about 5 or 10 here that start off with chronic illness and cancer. I'd recommend you go watch our webinar on breast cancer to see, to get a more in-depth discussion of that. That's in about an hour talking about specifically chronic illness and cancer, but everybody's getting sick. Everybody has to do this to get healthy. There's 98% of us are getting chronically ill, and 98% of us should not. Our genes are just fine. So the bad news is we're all going to get sick and die of something unnatural. The good news is this will prevent that, and it will reverse the risk for disease and get you feeling healthy in a matter of weeks, even if you've been sick for decades. We're convinced that new medicine is the absolute truth. There's so much out there that's misinformed, both from the traditional drug and surgery-based camp to the alternative camp. All of the quote-unquote complementary and alternative remedies out there to which there is no science. And I'll say that we know that these things work. We know we need some of these things, but before we spend a lot of money there, let's just spend a little bit of money on the science of the foundational biochemistry we need in new medicine and see how healthy our body can get, because you'll be amazed at how much reverses just with a good, efficient detoxification, proper hormonal balancing, and the rest of the functional science that makes the new medicine healing experience, and of course, even most importantly, the education that comes along with it. A quick run through, here are the big killers: cancer, heart disease, diabetes, obesity, autoimmune problems, osteoporosis. These are all absolutely epidemic and increasing. Don't kid yourself with the media. We are not winning the wars on any of these illnesses. We are getting sicker, quicker, and it's killing ourselves, it's killing our planet, and it's killing our economy. Now our children are getting sick with juvenile chronic illnesses, and again, with the new medicine system, the key components are toxicity, weaknesses in our nutritional world that we're talking about specifically on tonight, and these commonly cause all of the problems that get us sick, which are inflammation, weak immune systems, reactivity, deficiencies. They're all variations on a theme. We're going to get into inflammation a bit here. This is a great slide. We've got a lot of slides like this that are available to our counselors to print them out. We can make nice big glossies of them. These really would be good to bring into even health practitioners' offices. Heck, even bring this into a cardiovascular surgeon's office and say, hey, have you ever seen something like this describing why your patients are getting bypasses every 5 years and all of the drugs and surgeries that we're doing on them aren't fixing the key root of the problem, which is the inflammation inside their sick artery. That's the key. It's from the toxicity combined with the nutritional and hormonal deficiencies that disable our body's ability to naturally reduce the inflammation. And there's some very simple ways to find out how much inflammation there is. This is part of our standard labs, and there's different ways to think about it. There's the acute inflammation and there's chronic. You can have very high levels of acute inflammation with either of these markers, especially with C-reactive protein. I've seen C-reactive proteins up over 100 several times. When I see that, it means that there's probably something acute in this person, commonly a virus, an infection, a cold. However, sometimes also severely high with some autoimmune disorders, fibromyalgia, polymyalgia rheumatica, PMR, some big ones like that. And even low levels of C-reactive protein can be very problematic chronically. So you want to get C-reactive protein as low as you can. That's a common marker in the blood. Lots of media attention these days, but it's not what we're being told it is. It isn't only about hearts. It's about the whole body. You can have inflammation in your toe, in your lungs, in your autoimmune system, in your brain, and you're going to see an increased C-reactive protein. Almost anything can increase it. Of course, toxicity, infections, and lowered immune system function. Weak adrenal glands, low cortisol output, low androgens, low testosterone and progesterone, low omega-3s, low magnesium. All of these things that we were discussing tonight will contribute to high or elevated C-reactive protein. So it's a great marker that should come down. It's not specific for anything. When you reduce it, it means you're helping almost every body system out there. Homocysteine, a little bit more important for acute inflammation. No drug out there for it. They're saying it's not important. Well, we know it is. I've seen maybe one of the more ill patients I've seen, a young gentleman with repeated strokes in his 20s. His homocysteine level was over 30. That was very obviously a genetic problem. Homocysteine typically relates to adequate and properly replaced and balanced thyroid, of course bioidentically, but also B vitamins that we talked about before. It's a happy little triple triangle right there of keeping the homocysteine level down, which simply means you're keeping the tissues healthy so that homocysteine and inflammation, it's a marker of inflammation. The homocysteine isn't, I don't think it's directly a bad chemical. It's just a marker that there is inflammatory problems inside of your body, and this one can be more specific for your arteries. So this is a great thing that should be checked on everybody. And again, it's not specific for heart disease. It's, of course, related to heart disease, but it's specific for any illness because all illnesses, even cancer, are inflammatory. And this is the way we should be teaching you. So we can, again, go through the acute inflammation. It can be infectious, or it can be the beginning of something chronic. Another important thing about the biochemistry is that as we check the ferritin marker, it can be specific for the amount of iron in the body. And oftentimes, people have way too much iron these days. It stresses the body. It's a heavy metal, just like arsenic or mercury or lead. But sometimes it can be an inflammatory marker itself, so that's part of the training we give our physicians and our counselors when explaining labs or just discussing them, is that ferritin can mean a number of different things. And I went forward there too quickly. And all of these markers can be quickly reduced. I mean, we see C-reactive proteins drop from 10 or 15 down to 1 or 2. We see homocysteines drop from 10, 15, or 20 down to 5 or 10 where they need to be. So it's very easy to fix these things, always naturally. There's no medications for them. You know they're looking for them. In fact, a couple of years ago, they talked about using statins to lower C-reactive protein. What a nightmare that would be. And these are all very important for simply being markers of optimal health, of chronic illness prevention, and they're really not paying much attention to them, again, because there's not much money behind them. There's no drugs. There's no pharmaceutical industry behind them. So they're not talking about them much except to discredit their importance. Well, it's very obvious to us after thousands and thousands of labs that low inflammatory markers correlate very highly with good health, and high inflammatory markers correlate very poorly with good health. So it's very, very important. It's the common denominator of all illnesses, this inflammation, and actually beyond the inflammation is oxidation. So we'll talk about that a bit in a later seminar. So the inflammation stays around a long time. It becomes smoldering. It's more of that C-reactive protein of 2, 3, 5, or 10 for years and decades. It's a marker that our body's just wearing down. We have these inflammatory reactions everywhere. That's why everybody's reaching for Advil every day, and we're achy and we hurt, and we're developing all of these illnesses. And again, these are multifactorial things. There's not one solution to inflammation. It's not just omega-3s. It's not just hormonal balance. It's not just detoxification. It's everything. Fix everything at once, and that's when you see the power of the New Medicine Foundation treatment work, when you see these incredible lab corrections. So people feel great, they look great, they're off medications, their aches and pains are gone, they've lost weight. But for us as physicians, as true scientists that want to promote the science behind this, the proof is in the science, it's in the pudding, it's black and white in the labs that, again, we are using these labs that the traditional powers that we know about, they just don't really understand them or know how to fix them. Well, we do. And it's incredible when you see these things happen. So they're highly disregarded. And the multiplicity factor, if you've got a toxic reaction to a chemical and you're treating it medicinally with more toxins, but your body's hormonally deficient so it can't control the inflammation, and then you're nutritionally deficient with B vitamins or omega-3s or vitamin D3 and your immune system's imbalanced. I mean, think of this is how all of these imbalances add together to make somebody really, really sick. And that's what's happening to us these days. We're getting really, really sick really, really early. And it's unfortunate. I think we're getting on there to, I know when I start getting tired, it's probably enough for one night. Let's finish up with this slide. This is something to tie in even more of the hormonal issues with inflammation. We've talked in the past about how estrogen is high in everybody. Well, estrogen's inflammatory. Toxins are high. We know when we react to a toxin, you're going to become inflamed. Insulin is inflammatory. The high leptin levels, we don't know this, but I'll put a heavy wager that leptin's inflammatory as well. So these are all the things in the body creating that inflammation, all these hormones and toxins. And here are some of the deficiencies that would lower the inflammation, but we're deficient. How about just water? Water is an antihistamine. Water is a tremendous lubricant, so we're dehydrated. The omega-3s we talked about. The cortisol and adrenal fatigue. We all know how cortisone, when injected, is an incredibly powerful, or prednisone, these medications that are powerful and toxic. Well, just bioidentical cortisol is much more gently regulated by the body and can have tremendous effects on this inflammation. And the androgens, the testosterone and progesterone we talked about before, are also very, very soothing for the body. So we will, let's see, we'll do two more quick slides here, and then we'll wrap it up for tonight. This will wrap up inflammation. We'll get into some more next week. But here's just a quick slide to tie in that last slide. Cortisol is deficient in most people. It's adrenal deficiency. Cortisol is incredibly anti-inflammatory. We replace it in about half the patients we treat with bioidentical cortisol. The androgen deficiency and estrogen dominance issue we just spoke about, how estrogen is inflammatory. Vitamin D3 deficiency, which regulates our immune system. The B deficiency, which creates high homocysteine levels, a direct inflammatory marker. The omega-3 fatty acids, talking about how eicosapentaenoic acid is anti-inflammatory, and we are all deficient. These omega-3s lubricate our bodies. And water, we're all dehydrated, and water itself is a very good antihistamine. We talk about histamine, talk about allergies, and how we, for all of these reasons as well, removing the things we're allergic to, restoring the adrenal and immune system balance through cortisol, adrenal work, D3, all allergies typically get so much better. So we don't focus on food allergies per se. We teach people to eat real food, and we get their body balanced, and almost all their adrenal problems go away. This slide will look real small on the webinar. It's just another slide we have showing how all this ties together to inflammation. All of these can be available for the health style counselors. I'm telling you, you will be more equipped than a drug rep to go into a medical office and say, hey, doc, take a look at this. this is how new medicine explains how all this works, and this is how we fix it all. We talk about toxicity, nutritional deficiency, hormonal imbalance, how it all creates inflammation, which leads to oxidation and oxidative stress and aging. This is how we get people healthy naturally, promote healthy aging, and here's what new medicine does. We balance hormones, we restore the functional deficiencies, and we remove all of the toxins. It's a beautiful system. It works so well. And we've seen it for years now, and now we know how to get it out to the population, both through our health style counselors and virtually to the world. So we'll wrap that up tonight. It's a great bit of discussion. We're getting more into more of just the illnesses. People say, hey, I've got heart disease. Hey, I've got Alzheimer's. Hey, I've got arthritis. How does this apply to me specifically? We can talk about all that. We'll get into that in the next night or two and look forward to sharing that information with you. I will pass it back to Ms. Johnson. Thanks, everyone, for listening. And again, we're getting all this recorded, so it'll be available on the website here shortly. Thanks again.
Okay, thank you, Dr. Edward. Were you able to see the question that Donna had posed?
No, that's another thing I'm not getting is I don't get the questions.
Okay. She's asking if a client has swollen ankles, edema, I think it's called. She's saying, what do you do? It's a good question to have answered tonight. If you could address that.
Absolutely. Yeah, that's a good question. Well, edema, are you ready?
Yeah.
Edema is in the ankles is a couple different things. First of all, talking about inflammation tonight, we are swollen everywhere. Our whole bodies are swollen, both inside and out. It's part of what leads to blood pressure problems and weight gain and puffiness, and it is this inflammation that we directly monitor with these markers. So step one is just getting rid of the total body inflammation. Now, edema in the ankle specifically can be a couple of other things. Number one, it can be circulation issues, which we're going to indirectly help as well. It's just a question of the blood flow and the veins flowing and the lymphatic system flowing, all of the circulation flow being adequate. That also relates to balanced biochemistry and mineral and electrolyte balance and hormonal balance, just everything flowing in the body as it should. Weight gain, of course, is going to add to that. As we get heavier and heavier up top, it's going to block the flow of just basically all water from the body, and so it's just going to collect down and down into the ankle. So you've got to look at, it's going to be multifactorial again. You've got to look at everything in the body that's going on. Now, by the time you have severe edema like that in the lower extremity, that's where we're really going to be making sure that we get some follow-up labs as well. Initial labs are good, but you've got to reinvestigate this person 4 to 6 weeks in and along the way and see what's going on, see if things are improving biochemically, if we're getting the results we need, because that is a serious problem. You don't develop edema until you're really pretty far into some imbalanced health problems. So it may not go away completely immediately, and we're going to have to make sure we're really keeping a close eye on the science that we're talking about, the biochemistry of things, and that everything we hope to see correcting is correcting, because that's a significant problem. You also have to look at kidney flow. I mean, just making sure the kidneys are flowing well, and that there's a creatinine marker we need to look at. So we need to keep a look at some basic labs along the way to make sure we're doing everything we need to do.
Okay, perfect. Thank you, Dr. Pearson. That was excellent and great tonight. That was really very informative. This is a good call to have recorded, and anyone on the call, if you'd like a copy of this, you know what to do. Just please send me an email and request a copy, and I'm happy to send it to you. So thank you very much, Dr. Pearson, for your time. Thank you, guests, for joining us, and Bob Torsey, if you're still on, thank you as well. We will hear most of you on the call Wednesday evening. Remember, it's 8:30 Eastern. We're trying it a little bit later for our friends out in the West Coast. So we hope to hear you on that webinar. Have a great evening. Thank you.
Thanks, everyone. Good night.
Thanks, everybody. That was a great call, Doctor. Thank you, Patty.